What is it public health? I always try to explain the public health with this small analogy. Everybody has a smartphone. Imagine your smartphone drops and the screen is broken. Now you have to pay a lot of money to change the screen. But what if you had a protective screensaver? It costs you less, maybe less than $1. Changing screen is $100. Changing one screensaver is $1. Great save of the money. Then, if you want to replace the screen, you would have to find a person who can actually do it, who is skilled in repairing phones. And this person, to train him, again, money. This money goes from government's pocket. But if we give everybody screensavers, that is public health. This is how I usually explain public health to students in Kazakhstan, because every time I have to remind them what is it, so they don't forget. Now, in public health, there are several questions that are common for everyone, every public health system in every country in the world. This is going to actually lead us to essential public health operations, which there are 10 of them. They are well established, well thought, and they're developed by WHO professionals. And the question would be, how many people do have protective screensaver? How many people from the audience have protective screensaver? See? Less. Not everybody. Are there any hammers flying around so that are our phones in danger? Do you think so? Okay, this is the second question. Is there any danger of the water that can be spilled on the phone and the phone is going to break? These are the questions so that we can save the phone, right? And do people know that a case and a protective screen actually saves you money and saves your phone? Now, why I'm asking these questions is these questions are directly related to the public health operations. As I said, there are 10 of them. And the first question, how many people do have protective screen, is going for surveillance of population and health. This is epidemiology and biostatistics, the courses that every medical student attends. Are there any hammers flying around? This is monitor and response to health hazards and emergencies. For example, water flood or wildfire. So this is public health as well. Are there any danger of water spill on the phone? This is health protection, including environmental, occupational, and food safety. So basically, as you can see, every of these questions regarding to the phone does have implementation in public health. My favorite is the last one. Do we tell decision makers that screensavers is cheaper? This is actually a big thing in the whole world, because our systems are developed so that we train a lot of medical students and we do not train a lot of public health professionals. Whereas training a medical doctor takes 7 years. 7 years plus residency, maybe 10, 11 years in Kazakhstan. And training a public health professional, 5 years. And why do we need to have more research in public health? Imagine you are a Ministry of Public Health, because I believe some of you might be a minister one day. You have a lot of problems. You have a lot of things. You have to talk to see if the budget is right. You have to see if the people are trained enough. You have to oversee if the quality of the care is good. A lot of things are going on. And sometimes you don't even have chance to sit and analyze every problem. But you have a lot of people working for you. And these people are bringing you something that is called evidence-based. Evidence-based meaning that research has been done and there is actual proof that if we try this policy or this change, it can actually save us money and save people's lives. That's why we are going to talk a little bit more on research. This is nothing new to you, but it's just a refreshment for myself. So just a quick dig to the research world. If you're actually interested in essential public health operations, there is a link there, or you can just Google 10 EFOs. This is, I wish when I was a student somebody told me that, because when you go to one course, then you go to another course. When I took biostatistics, I didn't know how I'm going to apply it. When I took, for example, anatomy, Okay, well, there's no question in anatomy. But when I took something that is called health promotion, it only then, in my master's degree, everything started to tie together. But if we understand this essential public health operations early, it means that all the picture, you will see the bigger picture. And once you see the bigger picture, you will have more chance of doing something better. And in the relation of essential public health operations, as I said, there are 10 of them. This is the diagram that is explaining their relations. It is also available on the WHO website. You can look at it and you can work on it more by yourselves. Now, I started to talk to you, but who am I? Okay, this is me. Just 3 years ago, when I was head of strategy in the Republican Center of Healthcare Development in Kazakhstan, so for some short period of time, I was responsible for the strategy of healthcare in Kazakhstan. Yeah, but then I quit because it's hard. Since then, it's been 3 years when I'm working as an independent consultant. There has been 9 or 10 construction projects, and I had helped with numerous of research. And that is when I understood that even working professionals, clinical doctors, anesthesiologists, they don't use ChatGPT. There is a great tool that can help you to do something. Of course, it is not a panacea. It's not going to solve all your problems, but it can give you direction. And since 2020, when quarantine was, ChatGPT developed very quickly. And it's in our power to start using it early. The earlier you start, the more result you can get from it. Okay, and now I want to show you another picture. This is my face when I did my first research. I was very frustrated. I did not know anything about research because I was training to be a clinical doctor. And the plan is going to be like this. Our presentation is going to be in 2 parts. We'll talk a little bit about the research. We'll talk a little bit about AI, particularly ChatGPT, and how it can be applicable in healthcare research. And inshallah, we'll make a cool photo with all of you. This is the plan. Okay, now that you know me, I want to have 2 volunteers. We'll do a very, very small research right now. Probably someone from 2nd floor and 3rd floor. Do I have any volunteers? Okay, okay, thank you. Now I want you to ask to see if how many people from your row have protective screens on their phones. Please raise your hands if you have protective screens on your phone. Just the 2nd floor. Okay. And how many people of there are in the row? Okay. There are 8 of them. Okay, we have 8 people in total on the 2nd row, and only 2 of these people do have protective screen. What is your conclusion?
I think this student is very careful about the phones because they have a lot of data to use this, and this is important for us to save and care, of course, to communication with others and getting something in our phone. It's important because the students care about it.
Thank you so much. Now, if we look at on the epidemiological perspective, there are 8 people and only 2 of them using protective screens. How much in percent is going to that to be? 25%. Meaning that 75% of students are not using protective screens. Is it a research or not? Aha, this is a research, but you don't have enough people participating. So in research, as you know, we should have at least 30 people participating, at least 30. But the more people you have, the more accurate picture you're gonna get. Okay? But it's still not research, and do you know why? Because we did not have to document it. Once you document it, once the paper is ready to be printed, that is research. Because until you have results written and presented to decision makers, your research means nothing. You just have accumulated some information, which is unfortunately is not used at the moment. Okay. Very, very basic. What is research? Research is when we try to add something new and expand the knowledge. Expand the database, expand the understanding of some health issue or something like this. The most important thing about the research is it has to be systemic and it has to provide facts and figures. If it's systemic, providing facts and figures, this is a good research. If it's just a research that we just made with the second row, it's not a very good research. But how can we make a good research among, let's say, students community? Okay, that would be the next thing. Well, research, research is essential for learning. Research is essential for innovation. Research is essential for development. We're going to touch a little bit on this in the future, but I want to stop on characteristics on research. Each research has to have a clear statement of the problem. So when we initially spoke, and you could observe this whole audience, and I asked how many people have protective screens. Did I ask that? No, I asked about ChatGPT. Apologies, I should have asked. But you see your friends, you see other people on campus, and you can see if somebody is using case for a phone or somebody is not using case for a phone. And now you have an assumption. Maybe not enough students are protecting their phones. But this is just a state of the problem. Now we have to have the clear state of the problem before we start the research. What exactly do you want to learn? How many students on campus do have a case? Or how many people on the campus do have resources to buy a case phone? Because this is another question. So this is the first and the most important characteristic of the research. Second characteristic is establishes relationship between the cause and effect. What would be cause and effect if you don't use the case for your phone? If you drop it, it breaks. Okay, there has been research done. 10 people dropped their phone, 6 of them broke their phone. Cause and effect is there. Then it can give you the principle for prediction. Now, your prediction would be if you don't have your case, if your phone drops, it breaks. Correct? Yeah, that is the third. And it is based on observational, experimental, and empirical evidence. Now, of course, you have to know deeper about the issues that you're talking to, that you're doing research on, but the main characteristics are listed. Don't worry about the presentation, I'm going to share it, so it's not a big deal. And why do we need to have research? Of course, we want to have some scientific knowledge added. Of course, we want to improve medical and health practice. But how exactly are we going to improve medical and health practice? In my experience, first you find the problem. Then you do research on this problem. Then you make a proposal for decision makers. And then, inshallah, they see it and they say, okay, this is trustable research. The reputation of university is good. We have to listen to what they say. This is why we do the research. And other reasons are listed as well. So once you're an independent researcher as myself, you have to have different roles. And we'll talk about this a little bit later. Now, categories of research. Of course, there are different types of research. If you're working in clinic, then you can see what drug is working and what drug is not working. If you work in, let's say, in the field, then you can see if some, let's say, float with the water is damaging bringing more, let's say, infectious disease. All of these are research, but what we usually do in public health is qualitative and quantitative research. For a second. This is going to be the most important slide. This is how we actually do the research. I'm going to use this word a lot today, sorry about that. I mean the word research. Now, on the first column you see the questions that we need to ask, then the steps that should be taken, and an element to each step. This is step-by-step guide on how to make your small research. If you want to take pictures so that you have it, please do so. If not, just wait until you receive the presentation. Most important things that I did not have at the moment when I started my first research, remember that face that I made sitting with the laptop, is that I have to have the work plan. Because in Karaganda, in Kazakhstan, nobody taught me that I have to have the work plan on how to make the research. And trust me, it's all going to tie together to ChatGPT. Just give me some moment. Now, budget. Again, with ChatGPT, my expenses were coffee, and that's it. If I had to hire some people, there would be their salaries, there would be office, there would be equipment, everything. Now I'm good to go with my laptop. We'll come to that again soon. Major areas of health system research. Why do we do this? We do it to improve some policy. We do it to foresee some environmental problems. And we do it to help administration and management, and so on. I'm not going to stop a lot on this because I want to actually demonstrate you something. Okay, as I told you, all types of researchers are multidisciplinary in the nature, and you would have to have different skills. That's why I'm urging you to start using ChatGPT and developing a research early, so that you have the skills trained while you are in the university. Because I started to train it when I was experienced professional, and it was a very good tool, but if I started when I was a student, that would be so much better for me. I would have so much better understanding of the research, and so many grants that I applied to would actually come to me. But it is how it is. What we can do is, again, see on the skills that you about to develop, or if you have developed them, you're going to hone it so that it's very sharp and it's very good. And they are listed over here again. You should be able to read the policy. Let's say Ministry of Healthcare decrees a policy that says something. You see this policy, you do the analysis, what population is affected, how is it affected, and what are the possible outcomes. And then you do the research. And then you bring the results and see, this is good policy, or maybe we should add this or that. Then environment, of course, when it comes to environment, you have to know that, for example, in Karaganda region, there is a big factory. And everybody in the radius of 10 kilometers coughs every day. Now, I want to go to the factory and tell them, you should pay more taxes so that we can treat these people who live around the factory. And they, of course, they don't want to pay some more money. And they do ask me the question, is there a research that is proving that people that actually live around the factory are struggling with more health problems? Again, coming to research. Management, yes, this is most important. Why is it important? Because you would have to do this on your own or in a small team if you don't have budget, and you would have to be able to finish it. Because starting is hard, but finishing the project is much harder. So management is the key. Consistency is the key. Once you start, you go on. And of course, community, like behavioral science, like let's say you want to actually see if people around coal mine are actually using nasvar because they are not allowed to smoke inside the mine because it's explodable. And how is that affecting, let's say, health? Because as we know, nasvar is very dangerous for your lips if you drop it. So this is, again, if you need to do research on this topic, it comes to community. And let's go a little bit further. We're soon going to have a little break. Now, my question for you would be, I'm sorry, what was your name?
Bashir Ahmad.
Bashir.
Yeah.
Bashir Ahmad.
Bashir Ahmad.
Yeah.
Okay. Please tell me a little bit about yourself.
In the name of Allah, I'm Bashir Ahmed and I'm 22 years old and a student in Public Health Faculty in Kabul Medical University. And we are now in the last semester in this faculty, and we have two articles we're gonna publish in future. The first one is very important because we work a lot on that. That is the article name is prevalence of self-medication in Kabul Medical University.
Okay.
In 2024, we're gonna working some abstract or designing.
Okay.
And the second article we're gonna publishing inshallah is test anxiety and public health faculty students.
Okay, thank you. My specific question would be, are you from Kabul or are you from different region?
No, I'm from Kapisa province.
Kapis?
Kapisa province.
Kapsa.
Yeah, it's
Yes, Kapisa. Okay. Let's try and see if can you spell this for me? Because I'm apologies, I don't know this province yet. Can you spell it by letters?
K-A-P-I-S-A.
Kapisa.
Yeah.